How many times am I gonna say it? Hey guys, and welcome back to Mondays with me, Dr. Crystal. I hope you guys are doing well. I hope you had a great Easter if that's something that you celebrate. I'm still just here all alone, but it's fine because I have time to make videos for you guys. So also I've been making TikToks every day. I literally can't stop. So way back before all of this started, when I was still going to sporting events as a team physician, I was standing there during the national anthem one day and I was thinking, dang, I probably hear the national anthem way more than the average person. They obviously play it at the start of every sporting event, and then I'm the team doctor for multiple teams, so I'm going to multiple different teams' home games every month, and so I hear it a lot. So as I was thinking about that, it led me into thinking about even more things, like what do I do every day? What do I do every week? So today, we are gonna talk about my job by the numbers. So given all my newfound free time, since I am quarantining by myself, I had plenty of time to go back through our electronic medical record and see what I get up to in a month. So I went back to our last normal month, which was February, before all this craziness happened. As I hope most of you know, February is a little bit shorter than the other months, so the numbers might be a little bit off compared to like an average month. But since it's the last normal month, that is the one I went with, and that is what we're gonna look into today. This is all my data. Guys, it took me hours to collect this. All right, so first things first. As you know, February usually has 28 days. This year was a leap year, so there was 29. So out of those 29 days, 9 of them were weekend days. So during the week, Monday through Friday, I work in the student health clinic on campus. So that put me at 20 days in the clinic working during the month of February. So in addition to those 20 days, there were 4 weekend days where there was at least one sporting event I had to be at. So that puts me working 24 days in the month of February. 24 out of 29, not so bad. I had 5 whole days of the month where I had no obligations and could do what I needed to do. So every day I go into clinic, I eat an Uncrustable for breakfast, so I ate 20 strawberry Uncrustables in the month of February. All right, so during those 20 clinic days, I generally see patients from 8 to 5 or 9 to 6 with an hour lunch break. Now I know what you're thinking, an hour? Why do you need an hour to eat lunch? Trust me, I'm catching up on charts during that time. And so this is not me just like sitting leisurely eating my lunch. I'm almost always catching up on work during that time. During my 5-day work week, there's also one day where I get to be done seeing patients a couple hours early so that I can catch up on my administrative tasks. All right, so during the month of February, my busiest day, I saw 23 patients, and there were a couple days like that. My least busiest day, I saw 12 patients, and that was one of the days where I got to leave early to do my administrative stuff. So in February in total, I had 385 patient visits. In addition to seeing, talking to, examining, diagnosing all of these patients, I also have to write a note for each patient visit. So that means in the month of February, I wrote 385 patient notes as well. That's a lot of notes. On that note, I'm currently considering all offers to come be my scribe for free. All right, next on my list, I added up the number of throats that I looked at throughout the month. There are multiple reasons to look at a throat. Obviously, if someone's having a sore throat, I'm gonna look at it. Oftentimes, if somebody's coming in with just like cold symptoms, a cough, runny nose, that kind of stuff, I will also look in their throat. For a thorough neuro exam, you also have to look in somebody's throat, so all of those are taken into account in this number. And the total number of throats I looked at during the month of February was 83. That's a lot of mouths to look into. It's so crazy that even just back in February, I just took it for granted to look into somebody's mouth. Like, I wasn't wearing a mask at that point, coronavirus wasn't in our area yet. It's crazy to think that that was just a month and a little bit ago. All right, the next thing I looked at is the number of musculoskeletal visits I had. So for those of you who have been here, you know that I'm sports medicine. This is my jam, this is the stuff I like to do. So this is issues with like muscles, joints, bones, that kind of stuff, people coming in for injuries. Of course, I don't like when people are hurt, but I like to diagnose you and help you get better. So in the month of February, I had 82 visits for musculoskeletal complaints. So in those numbers, I included initial visits, follow-up visits, visits to go over an MRI. So I had one less MSK visit than the amount of throats I looked at. I prefer it be the other way around, but I'll take it. It's pretty even. All right, so this is the last thing I looked at in relation to the type of patient visit. So I wanted to know how many people in a month I talk to about their sexual practices. So there are multiple reasons why I would have to talk to somebody about this, the most common being someone coming in for STI testing, but we get a lot of people coming in with burning, discharge, males and females, any female that's having abdominal pain. So I talked to 29 people in the month of February about their sexual practices. I do my best to approach this conversation in a kind and non-judgmental way, and so I hope I did that for these 29 people. I know it's easier said than done, but you guys should never be concerned or embarrassed to tell your doctor about something related to your sexual history, because I promise you, we've heard it all. All right, so I'm done with clinic and now I'm on to sports. So as a team doctor, I have 4 teams that require sideline coverage, and so that is in addition to my time at the clinic. So whenever they have home games or home events, I have to be there. So my 4 teams that require coverage are men's basketball, women's lacrosse, and women's soccer. So during February, 3 out of those 4 teams are in season. So during February, it was pretty even for all the teams. Men's basketball had 4 home games, women's basketball had 4 home games, and women's lacrosse had 4 home games. So in case you're not good at math, that's 12 home games that I was required to be at. So some of those games are after clinic, where I would head there after seeing patients all day in clinic, and some of them are on the weekends, where I would just go and that would be my only responsibility for the day. So all of those games average about 2 hours apiece. I usually get there a little bit early, and then I have to stay a little bit after to see anybody who needs to be seen. But I didn't count that, so just game time, I spent about 24 hours at games in the month of February. In addition to those games, there's also a big boxing tournament that Notre Dame holds every year, and that took place in the month of February. So there were 4 dates for that this year. I was only able to make 2 of them due to conflicts, and so both times I was there, I spent about 4 hours there. So that is 8 hours covering a boxing tournament. Seriously though, every time I watch them, I feel like I can box. All right, so we're finally to the calculation that started it all. So I was at 12 games and 2 boxing events during the month of February. That means that I heard the national anthem 14 times. So I looked it up. The average amount of time it takes for a performance of the national anthem is 1 minute and 55 seconds. So it depends on the event. Sometimes people sing it at our games, sometimes it's pre-recorded, sometimes it's the band, and so I'm sure it's different, but I'm using the average of 1 minute and 55 seconds. So that means I spent a total of about 27 minutes listening to the national anthem in February. I honestly thought it would be more than that, but that's still kind of a lot of time to listen to the national anthem. All right guys, so there you have it, my job by the numbers. I hope you guys enjoyed this video today. It was fun for me to look back and see what I do over a month's time. So it was fun for me, I hope it was fun for you. If you liked the video, please don't forget to give it a like, subscribe if you haven't, and I'll see you next time. Woo!